Hello, everyone. I'm Sam, and I'll be going first. Now, does anyone here know what the largest organ we have is? If your guess was skin cancer, well, then you'd be correct. If you couldn't tell, I'll be talking about skin cancer today, one of the most common forms of cancer in the US. I'm going to give you a little bit of info on what skin cancer is and the types that are common. Then I'll go over risk factors and causes, and finally, I'll wrap that up with treatment and diagnosis. So, what is skin cancer? Well, as described by the American Dermatology Association, skin cancer is the abnormal growth of skin cells, usually by ultraviolet rays. And to be a little bit more specific, there are three common types of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, and melanoma. These names tell you what cells are specifically affected. So let me give you a little bit more info on these three types of skin cancer. First off, with basal cell carcinoma, or BCC for short, this is the most common form of skin cancer, with an estimated 3.6 million cases per year. Now, as the name implies, BCC affects the basal cells. The basal cells line the lower part of our epidermis, which is the outermost layer of our skin. They produce new cells that will eventually turn into new skin. With the squamous cell carcinoma, it affects, you guessed it, the squamous cells. These cells take the new skin cells produced by the basal cells, and as they move upwards through the epidermis, flattens them to create new skin. Last, with melanoma, and I'm sure many of you have at least heard of this name before, is the most serious form of skin cancer. The Skin Cancer Foundation estimates that there will be upwards of 207,000 cases this year alone. Melanoma targets the cells that produce melanin, which is what gives our skin its pigment. Let me talk to you about the risk factors and causes of these three cancers. The main causes tend to be the same for all three types, the usual suspects tending to be, but not limited to, ultraviolet light. For BCC, the DNA of basal cells mutates and rapidly produces new cells and continues to grow cells that have otherwise died off. For SCC, the DNA of the squamous cells is altered and starts to grow cells past their normal lifespans. Melanoma is similar to the prior cancers, where damage to the cell's DNA causes cancerous growth. The shared risk factors for all three are chronic sun exposure, fair skin, immunity suppression, and a personal or family history of skin cancers. Some BCC-specific risks are aging or arsenic exposure, some SCC and melanoma. Risk factors are a history of sunburns, and some melanoma specifics are frequencies of moles and living in high elevation or living near the equator. Now, with all the serious stuff, the outlook isn't actually that bleak. With the proper prevention and paying attention, even the worst of them usually aren't fatal. So let me tell you about how diagnosis happens. So let's say one day you're getting ready and you see maybe a rash, a lesion, a new mole you haven't seen before. What you want to do is you want to contact a doctor. They'll go through a process of asking you questions about your personal or family medical history. They'll go put you through a short physical exam. If there's evidence or an assumption of skin cancer, then they can give you a biopsy. All this is the removal of a small amount of skin that can be sent to the lab to be looked at further. If it does come back from the lab that you have a type of skin cancer, well, then the treatments are as follows. For BCC, it's cut and dry, cutting being the first method. But if surgical removal of the affected skin is not the move, then they can either freeze or apply topical treatments to the affected area. With SCC, it is a little less drastic for procedure. They usually just either freeze the area or use lasers to remove the cancer. For melanoma, it'll usually fall onto surgery for removal of the skin cancer and a slight area around that skin cancer. But with any of these, if it does get severe, then either radiation or chemotherapy can be applied to help kill the cancer. But this is only a worst case scenario and not the norm. Everyone enjoys some fun in the sun, whether it's working outside or getting a tan at the beach, but in order to enjoy these days off, we have to keep our skin safe. We need to make sure to take the proper precautions to keep an eye on our skin to ensure we can still have fun. So, some sunscreen here and there and a little bit of shade will help to keep us safe when the sun's out. Now I'd like to pass it on to Caitlin for the next topic.